terms of the elements of how NHIF operates, you know, you have membership, you have people who contribute, you have a product, you have providers that you contract, and the patients have access to the providers when they're active. That mechanism is very straightforward, and it is replicated even in the private sector. However, the biggest difference that I learned or I got to experience is the scale. The scale of NHIF in terms of the size, in terms of the membership, in terms of the payments of claims, and the complexity of the organization, including the impact that it has. That scale was what I would say the biggest learning and experience, because as we speak, with right now we've just crossed in total membership that have been over 10 million, slightly over 10 million. And if you multiply that by the number of lives in a household, we're looking at close to 44% of the country's population have been or are members or have been members of NHIF. So that scale was big and a big learning for me. Because in a pandemic, you, first of all, it's new. It is worldwide spread, because the only person who can even declare a pandemic is the WHO.
That's right.
You do not know the extent of the, you do not know how much it will end up costing. You do not know how long it will last. And if you go back to the promise that you also give as an insurance, that you've given me 6,000 shillings and I've told you you can get these benefits. In case of a pandemic, even those hospitals that I'm telling you that you can get services, it can affect them to an extent that they're shut down. So even the promise that I've given you that you can get these benefits, you will not be able to access, because where to access does not exist, because these are the scenarios of a pandemic. And if you remember, even like those days of the Ebola pandemic, for example, whole villages were shut down, the hospitals are shut down. So even if you have insurance and saying it will pay, there's nowhere to access that service. So that's why it is excluded. However, with learnings, with experience, you can end up now modeling to pay for certain conditions with time after you've gotten the experience. And a good example is HIV. When HIV came and it was declared a pandemic initially, you remember nobody was paying for it.
That's right.
Nobody was paying. But after some time, we understood how the disease behaves and were able to model. In fact, when I used to be at Resolution, I told you we modeled the first HIV cover. And so it is possible. So right now, if you look at a pandemic, and if you also invoke the Public Health Act, for example, if it is, when it is funded, we're able to coordinate to access the service, coordinate that the costs are also contained in our current realm. Like for the group life, you know that public servants and frontline workers and the Kenya Police negotiated for group life that also caters for COVID, and so we would use those funds then to support that treatment. So it is a complex scenario, and it's something that working together with government and the Ministry of Health to be able to contain and also understand the progression. You see, like now we're undergoing the third wave.
That's right.
And the numbers have really gone up. Costs have gone up, but working together to support. So even our strategic plan, 2018-2022, is that by next year, by 2022, that we have 21 million members. So, and that has been, the progress has been ongoing. And right now, with our focus on UHC, that is what we want to achieve. Because even with the 22 million members, if you multiply by the number of people in a household, we realize that it's the population. So we do have that target to get to UHC, and with that support that we are getting from the government, from His Excellency and from the Ministry of Health, and if we have, you know, all who can pay to be obligated to pay, and supporting those who cannot pay, we will definitely get to those numbers. But we are on course in terms of getting there through our partnerships also. Like this morning, I've just met with the Boda Boda Association of Kenya, who have 1.4 million members, and we're working to ensure, to see how they can be brought on board to ease their burden in terms of health and improve their welfare. So we're also meeting with Matatu Owners Association, and you know, also our interactions with the counties to be able to bring on board other associations. So this is something that is ongoing.
I see.
Yeah.